your trusted medications could be slowly destroying your liver. In the quest for health and well-being, we often turn to medications as our allies, placing our trust in their healing powers. Yet, what if these very medications, the ones we rely on to cure our ailments, were secretly wreaking havoc on one of our body's most vital organs? The liver, a resilient and indispensable organ, works tirelessly to detoxify our bodies and regulate essential functions. But behind the guise of relief and healing lies a startling truth. Certain medications may be silently undermining its integrity, posing a grave threat to our health. But fear not, for knowledge is power. By understanding the medications that pose a risk to our liver health and taking proactive measures to mitigate these risks, we can safeguard our well-being and ensure that our trusted allies in healing remain just that, true allies, rather than unwitting saboteurs. Now you are probably asking yourself what these medications could be. Let's get right into our first one on the list. Hey, if you're enjoying this so far, drop us a like. Without further ado, our first medication is acetaminophen, also known as Tylenol. Acetaminophen is generally safe when used as directed, but taking too much can overwhelm the liver's ability to metabolize it. Excessive acetaminophen can lead to the production of toxic byproducts that damage liver cells, causing acute liver failure in severe cases. Up next is non-steroidal anti-inflammatory drugs, also known as NSAIDs. NSAIDs like ibuprofen and naproxen can cause liver damage, particularly with long-term or high-dose use. They can affect blood flow to the liver and interfere with its ability to detoxify harmful substances. This next one is important, and it's statins. While statins are effective in lowering cholesterol and reducing the risk of heart disease, they can sometimes cause liver enzyme abnormalities or liver damage. This is more common in individuals with pre-existing liver conditions or those taking high doses of statins. With this next one, it's methotrexate. It's crucial to note that methotrexate is used to treat various conditions, including rheumatoid arthritis, psoriasis, and certain cancers. However, it can cause liver toxicity, especially with high doses or prolonged use. Methotrexate interferes with the production of DNA and RNA in rapidly dividing cells, including liver cells, leading to liver damage. Who would have thought that this next one in the list would be antibiotics? Well, some antibiotics, such as erythromycin and tetracycline, can cause liver damage or liver enzyme abnormalities. These very medications are used for everyday types of infections, from earaches, respiratory infections to STDs, and more. This is more likely to occur with prolonged use or in individuals with underlying liver disease. You might have heard about some certain antifungal medications like ketoconazole can cause liver damage or liver enzyme abnormalities by interfering with the synthesis of ergosterol, an essential component of fungal cell membranes. These medications can also affect liver metabolism, leading to liver toxicity. Did you think we were done? Oh no, not yet. There are other factors that can significantly increase the risk of medication-induced liver damage, so let's dive right in. First on our list is alcohol consumption. Yes, you heard it right. Drinking alcohol can exacerbate the liver toxicity of certain medications. This is particularly true for drugs like acetaminophen and some types of antibiotics. It's like adding fuel to a fire that's already burning. So it's always a good idea to limit your alcohol intake, especially if you're on medication. Next, we have underlying liver conditions. If you have a pre-existing liver disease, such as hepatitis or fatty liver disease, you're more susceptible to medication-induced liver damage. So it's crucial to manage these conditions effectively and be extra careful about the medications you take. Last but not least, we have drug interactions. Some medications can interact with each other or with other substances, increasing the risk of liver toxicity. It's like a dangerous cocktail that can harm your liver. Therefore, always consult your healthcare providers and pharmacists about all the medications and supplements you're taking to avoid any harmful interactions.